Anthony Hopp with Samaritan Ministries. They are a health sharing ministry. And here at Financial Issues, we want to help you be a good steward of everything that the Lord has given us. So we know that we've been talking about inflation and how we're spending so much more money on food and energy and housing and all of those things. And so as our budgets get crunched, we start to look for ways that we can be more efficient. And I think that we can find that with health sharing. It also is a great way to steward our health care. So we welcome Anthony. Thanks for being here with us today. We're always so glad to have you and hear what's going on at Samaritans.
Good morning, Shanna. Good to be with you this morning.
Great.
Yeah, well, we certainly are seeing quite a bit of craziness, not just financially, but I think just as we consider where our culture is going. And as you mentioned here in the intro, healthcare sharing provides a way for followers of Jesus to really be able to address three primary challenges that we face, not just in healthcare. I think throughout our lives as Christians, it's financial, it's the issue of freedom, and the issue of faith. And Samaritan members have been taking this approach of sharing one another's medical needs for about 28 years now, and there's about 83,000 households or 270,000 members in all 50 states who every single month are sharing $30 million with one another, person to person.
That's amazing. And so as we talk about inflation being up, FISM News ran a story that, of course, consumer prices are up 12.7%. The average workers lost $3,000 a year in purchasing power. The Fed's raising rate. All of these things are happening. Tell us about the cost savings tools that members of Samaritan Ministries are able to use.
Yeah, well, you hit one of the big challenges, which is with prices rising and income not rising. That means Americans have less discretionary income, less money in their pockets. You couple that with the fact that health plans are continuing to increase. It's a tough situation, and Samaritan members are able to have a healthcare solution that can start as low as $99 a month, up to about $600 a month, which, compared to health insurance plans, really is a fraction of the cost. It's not uncommon for us to hear from prospective members that they are spending more on their health plan than they are their mortgage. And even though mortgage rates continue to increase and we're dealing with inflationary pressures, healthcare plans continue to go up as well. And so that's just one of the areas that members receive benefit, is all of that cost savings. But not just in the monthly amount that members send. Of course, there's a huge savings, because instead of spending maybe $1,500 or $2,000 a month with a high deductible, not only do members have a lower monthly share, but we provide tools for members to be able to find fair prices when they actually do have a medical need. We implement a tool called Healthcare Blue Book, which allows members to find not just the quality providers, but also fair prices in their areas. And then also, we had a couple of pieces of legislation that really are fundamentally good. One of them being the hospital price transparency rule, which took effect as of January 2021. That requires all hospitals to publish their cash pay prices. A lot of people don't realize that, because for so long there was absolutely no price transparency. And that, fortunately, is changing. The other bit of legislation that folks may not be aware of is the No Surprises Act. That was implemented as of January 2022, just about 9 months ago. Hospitals have to provide an estimate up front for a cost estimate of the procedure. And if the patient requests that, the hospital is obligated to provide that estimate. And not only that, Shannon, but then once the procedure happens, they're required to stay within $400 of that estimate. And again, all of that should be posted on each hospital's website. But in the event that our members have trouble locating that information, our provider relations department comes alongside the members to help them secure the fair price.
That's good stuff, because over the years, ever since Obamacare came into existence, we've seen even marketplace insurance premiums continue to go up and up and up every single year. And we've also seen the benefits continue to go down and down and down, which means just more money out of people's pockets. And then when you actually go to use the benefit that you're paying so much for, you get a really big surprise at how little it does cover. So I'm really glad that there are options like Samaritan's Ministries out there.